everyone, welcome back to my channel Medicare Secrets, where we uncover the mysteries and the mayhem of Medicare. Okay, so we got a good one for you today. Medicare Advantage plans are about a little over half of our population of people on Medicare are on Medicare Advantage plans. So that is one way you can have your Medicare set up. It is some refer to it as privatization of Medicare. It takes our federal program, and an insurance company actually takes over your Medicare, and it's a network plan, an HMO or a PPO. So you have to make sure your doctors are in network, or if it's a PPO, you won't have as rich of a benefit. You can go out of network. Medicare Advantage means that you have a network plan. So our hot topic today is CMS, which is the Center for Medicare and Medicaid. That's who governs, who controls, who is in charge of our federal Medicare system, CMS. So they are now reaching out to the public, that's you guys, for feedback on Medicare Advantage. I think this is so incredibly important because we have such a huge population of baby boomers. Over 10,000 people a day are turning 65 in the country currently. So it's so important to, first of all, know what the difference is between being on a Medicare Advantage plan versus being on original Medicare. So that's a whole nother topic. I have videos that cover that. Let's get right into this article asking for feedback. I think it's so great, and I'm going to have links below that you can click on, and you'll be able to get your voice heard. All right. Some people love their Medicare Advantage plans. Some people have issues with them. There's a mixed bag out there, I can tell you that. So hang on, we're getting right to that video.
In the Healthcare Dive, which is a free newsletter about Medicare, it's something that I like to get. It's interesting to read. So I'm sharing the article with you. I think it's really, really interesting. It was published yesterday, August 1st, 2022. CMS calls for public input to improve Medicare Advantage. So I think it's pretty nice. CMS is the Center for Medicare and Medicaid, and they oversee the Medicare and Medicare Advantage programs. So they want to so let's go into the briefing here. I'm going to read it to you, and I'll give my feedback as we're going along. The CMS is asking for public feedback on how to make the Medicare Advantage program more affordable, sustainable, and equitable for enrollees while driving better healthcare outcomes. The agency on Friday published a request for information to aid in future rulemaking and policy development. The request for public input comes after the HHS, Health and Human Services, Office of Inspector General identified a pattern of improper coverage denials by Medicare Advantage plans. All right, I'm going to stop right there, guys. The request for public input comes after the HHS Office of Inspector General identified a pattern of improper coverage denials by Medicare Advantage plans. So what that means is if a person's on a Medicare Advantage plan, then they need something, their doctor has ordered something that could be medically necessary for the patient, for the Medicare beneficiary, it could be denied by the Medicare Advantage plan. Because an insurance company actually takes over someone's Medicare when they are on Medicare Advantage. So it's pretty interesting. They want feedback. They want to make these programs more equitable for people. So I'm holding my breath, and hopefully it'll all go well. Okay, so where were we? The American Hospital Association accused MA plans, it's Medicare Advantage plans, of illegally restricting beneficiaries' access to medically necessary care, which is what I just said. If a doctor orders something medically necessary, and if you're on original Medicare, Medicare has to pay it, 80%. But if you are on a Medicare Advantage plan, well, then you're on an insurance company's plan, and they take over your Medicare. And they make those decisions if you can have a procedure or whatever your doctor has ordered that's medically necessary. So the AHA the American Hospital Association has urged CMS and Congress to hold the plans accountable. CMS said it's looking to increase engagement with both its partners and its communities it serves, encouraging input from beneficiary advocates, plans, providers, community organizations, research employers, unions, and others. So they basically want to hear from everybody in the public to see what's going on as far as these Medicare Advantage plans and what could possibly be changed. So it's pretty interesting. It's being looked at. Seniors have flocked to Medicare Advantage plans over the past decade. Attracted by affordable premiums, prescription drug coverage, add-on benefits such as dental and vision, and other features. The plan's popularity has pushed the overall program enrollment to 29 million participants. Wow, or 45% of all Medicare members. So I had said before, I thought Advantage was over 50% because I was accounting for people who are on Medicare, Medicaid. But anyway, so basically half the population of people on Medicare, almost 45%, are on a Medicare Advantage program. The other 55% are on they're on original Medicare, and they might also, in addition, have a Medigap or Medicare supplement plan. In fact, if they're not on a Medicare Advantage, they either are on a Medigap plan or have Medicaid, Medicare and Medicaid, if their income's low. But most people don't just have plain Medicare because original Medicare only pays 80%. Okay, moving on. Medicare pays private insurers fixed rates to manage care for beneficiaries in the program. Very important sentence I just read. I'm going to back it up and slow it down. Medicare pays private insurers fixed rates to manage care for beneficiaries in the program. Wow. What that means is we have a national Medicare fund, and money from that fund, which we call Medicare loosely, they pay private insurers, so insurance companies, a fixed amount. I've heard, $1,000 a month, so $12,000 a year. That's what I've heard, to manage care for beneficiaries in the program. Okay, so that means that when you're on Medicare Advantage, you literally turn over your care, your health care, your Medicare to a private insurance company to manage. And they've been paid by the government over here, Medicare. Okay, so just, I like to let everyone know the transparency of because there's too much hidden. That's why I like to uncover these articles so that we can, you can understand. Okay, here we go. But along with the plan's success have come accusations of improper payments and care denials. Lawmakers in both the Senate and the House have called for increased oversight of the program, raising concerns about the quality of coverage offered by Medicare Advantage plans and unscrupulous practices to boost reimbursement for MA, Medicare Advantage organizations. So what that means is that, the White House, everybody out there in Washington, the lawmakers, they've called for a very deep look at the Medicare Advantage program, I hope, and, because there can definitely be improvements upon it, for sure, and, they're raising concerns. Because sometimes the program or Medicare itself is being taken advantage of, funny pun, but by unscrupulous practices to boost reimbursement. So there could be times that a doctor, I don't want to point fingers, but doctors maybe can bill for something for a patient that wasn't necessarily something that the patient needed, and they bill it to their Medicare Advantage plan program that then bills Medicare or has a setup with the government, and it's very complex. But but there are lots of things going on behind the scenes that I don't want to go over right now. But I think more will be coming out about the unscrupulous practices. So the Health and Human Services, OIG, issued a report in April that found Medicare Advantage plans wrongly denied care to enrollees, turning down 13% of prior authorization requests that would have been approved under traditional Medicare. So what does that mean? That means that Health and Human Services found in April that Medicare Advantage plans said, nope, you cannot have that care, turning down a whole 13% of prior authorization requests that would have been approved under traditional Medicare. I've read it twice, but it's really difficult for me to think about and awful. The plans also denied 18% of payment requests that should have been approved. So what that means is that because these are private insurance companies who have taken over your Medicare or a person on Medicare Advantage, it is up to them to approve or deny coverage. And they don't have to follow the rules of original Medicare, which has to follow the rule of if your doctor has deemed something as medically necessary, original Medicare or traditional Medicare must pay it. at 80%. Once a person is on a Medicare Advantage plan, they are no longer on that federal or original or traditional Medicare program that pays the 80%. They're on a private insurance company insurance plan, which has managed their Medicare and taken it over completely. So it's up to then that private insurance company to make decisions. So that is something that I always try to tell clients and friends and family. You know, one thing that's one big thing I get real nervous about when it comes to Advantage plans. So I hope that the public, whoever's out there, and I'm going to include a link to at the bottom of this video so that you know where you can reply to get your voice heard. That's what the purpose of this video is. I'd like to have everyone make give feedback on these Medicare Advantage plans. So that's why I'm posting this video. Okay, the OIG report urged CMS to update its audit protocols and issue new guidance on medically necessity reviews performed by the plans. Researchers have also warned that the program is a key driver of Medicare's overall fiscal woes. So again, because of these unscrupulous parties who are overbilling or mischarging or things like that with billing into these, using Advantage plans in a negative way, at billing in a negative way. It actually, researchers have warned, and I mean, this has been going on for a while, but that the Advantage Plan program is one of the main reasons they're saying is a key driver of the fiscal woes. So Medicare is always crying poor, and they're saying that Medicare Advantage is actually robbing original Medicare, and that was not what it was set up for. It was actually set up to take some of the financial burden off of our Medicare system. Okay, so anyway, moving on. In its request for information from the public, the CMS said it is inviting input from a wide variety of voices. We see a huge opportunity for partnership with as many stakeholders as possible to better understand how care innovations are changing outcomes and costs and how Medicare Advantage is working for enrollees. The CMS asked for feedback on steps the agency can take to improve health equity for MA, Medicare Advantage enrollees, and what tools beneficiaries need to select Medicare coverage options. The agency is also seeking input on how to support payment innovation, accountable care delivery, and effective competition in the Medicare Advantage market. CMS said comments from the public must be received by the agency by August 31st, so by the end of this month. And again, I'm going to share the link where you can reply and put your information that will go directly over to CMS. Explaining your feelings on Medicare Advantage. So that it takes care of the article portion of this video, and I'm going to return to the other part. All right, you all have a nice day.
If you enjoyed the article, and remember to reply, give your feedback if you're on Medicare Advantage, or even if you're not, give some information out there. I will, again, include the links down below. If you like the video, feel free to click the like button. That helps with the algorithm of YouTube. And also, please subscribe. I would appreciate it. And also, click the bell icon to all so that you're notified every time a new video is posted. I try to read through all the most updated information on Medicare so I can bring it to you so that you know what's going on. Until next time, thank you for joining me on Medicare Secrets, and I will see you all next time. Bye-bye.